We have patients that come to clinic all the time that have large disc herniations or other problems in their back. They are looking for solutions, but haven't worked with physical therapy yet. We will usually tell them, while surgery might be beneficial for you, we'd like you to go and see the physical therapist first. What would be your explanation to patients as to why, even in the setting of a large disc herniation or something that seems obviously surgical, would a patient benefit from going to physical therapy?
Herniated disc is what got me into physical therapy to begin with. And, I hurt my back in high school. Thought I broke my back. Luckily, it wasn't broken. But I went to physical therapy school to figure out how to treat my back, because I'd been to so many different clinicians, conservative treatments, and none of it helped. And so I started realizing that mechanical forces, how we sit, how we sleep, makes a huge difference to allow the disc to heal, position. And so usually when people come in, I explain, you need to understand the anatomy first. And so as I explain the anatomy to my patients, it makes a lot more sense to them. When I tell them, hey, you need to sit this way or sleep this way, they start getting it. It's just like a broken bone, and you can't, the doctors, reset the bone to get it in alignment and then put you in a cast to prevent movement so the bone can heal. So discs are similar. And once people can understand how it works, then they're very compliant in the positions I teach on sitting and sleeping, and they're really shocked how fast their pain starts to resolve.
Mm-hmm. You talked about this idea that the body tenses up around stress or an injury and even overreacts to various insults, such as a sprained ankle with all the swelling that you get, or in the case of a lower back issue, a herniated disc. Could talk to us a little bit more about what the body does in a situation like that that's counterproductive.
So we have these built-in reflexes to protect us from harm. And so, people understand that you touch a hot stove, you're going to pull away. And so or somebody jumps out and scares you, we have the startle reflex where people lean back and eyes open up, hands come up. These are hardwired into our nervous system to protect us. The spinal cord is essential for our existence as well. Just as the startle reflex is all about protecting the head, because if we lose the head, the rest of the body is no good. But if you think about the body is also going to protect things like the spinal cord that are essential for our existence. If we sever the spinal cord, we're paralyzed. And 150 years ago, we weren't going to live if you can't go, plow the field or grab water. And so from the well, so those reflexes are very much protective around the spine. So when you have any irritations of those spinal nerve roots that come out, maybe from a disc that's bulging back, or maybe from stenosis, where the narrowing of where that nerve comes out, it starts this a protective reflex that kicks on, and the muscles start tensing up. And people, if you ask them, they can feel the muscle spasming, and it limits how much movement they have. And so Dr. Sherrington was a researcher, physiologist in the late 1800s that started realizing these reflexes are contributing to things like pain. Mm-hmm. He didn't really necessarily correlate with pain, but he started seeing how these reflexes work, and that tapped us into help understand how those muscles are splinting to protect you, and we can deactivate those reflexes very quickly by going to the opposite muscle group. So if I'm contracting my bicep, the tricep has to turn off for me to bring food up to my mouth. And understand that concept, when a muscle starts spasming to protect you, we had the idea like, well, what if we go over here and overstimulate the opposite muscle from that muscle that's spasming? What would happen? And come to find out, it actually deactivates that muscle that's spasming, and then you can start moving a little bit better.
I love that. I think the concept of the body reacting to protect the nerve or the spinal cord as one of the main reasons why disc herniations or other spine problems are so painful. The body's trying to protect the area, and if we go in and do surgery, we may address the underlying issue, but that protective mechanism may still be overreactive. So looking at it both preoperatively and postoperatively, and hopefully in many cases just preoperatively because they don't need surgery, is advantageous to everybody. Engaging in conservative measures through the whole process is really helpful, because the body has a tendency to react in ways that are counterproductive. We ice a swollen ankle, for example, and we see a physical therapist and a chiropractor for disc issues in our back rather than just jumping right to surgery.
Yeah, it's there's a lot that can be done conservatively, before we get to the surgery, but and surgery needed at points. Then it does introduce some other challenges later. It can change the forces, and the scar tissue can tighten up, and then cause some other secondary issues to develop later on. So yeah, it's nice to be able to have that option to try to
keep working hard so nobody ever needs surgery again.
Yeah.
Okay, thanks a lot for presenting this morning. It was
Sure.
great.
Yeah.